Now, the member of the Executive Council for Health and Wellness in Gauteng, Nomantu Nkomo-Ralehoko, has called on the police to leave no stone unturned in bringing to book criminals who stole a 10-meter copper pipe that supplies oxygen to various sections of the main intensive care unit at the Hani Academic Hospital. The theft of the oxygen supply pipes was discovered on Monday after clinicians at the facility noticed that the flow of oxygen was lower than normal and reported the matter. The incident put the lives of 24 patients at risk, 19 of whom were on life support and dependent on access to oxygen through artificial ventilation. Motalatale Modiba joins me. He's a Gauteng Department of Health Head of Communications to unpack this. Well, good to see you and thanks for your time. We understand this very tough one for the hospital and patients and even families, where criminals now targeting hospitals in South Africa, specifically with the Hani Hospital being the latest. How alarmed should citizens and stakeholders be?
Well, it is a concerning situation, of course, and but I don't think that it calls for alarm. We do have security at many of our facilities, both physical security and your CCTV security. What we've been doing is that we have strengthened cooperation between our health facilities and law enforcement agencies to ensure that we clamp down on this kind of incidents. We've had a number of incidents, of course, Hani, Baragwanath being the latest, and another incident that happened at Motalatale, where 5 officials were subsequently arrested, and actually those officials have been fired from their jobs, and criminal proceedings or cases are proceeding against them. Even now, we've opened a case against this latest incident where we find that criminals now target, obviously, our facilities, because hospitals, by their nature, are supposed to be places of healing. They're supposed to be places where people can be able to roam in freely. And we would not want a situation where we now militarize our hospitals, because we think that those are safer spaces that people come to because they want to get help. But it's something that we were working closely with our law enforcement agencies to make sure that we clamp down on.
Well, good thing that some arrests have been made, but again, let's speak more of on the interventions that are being put in place to ensure patients are safe, especially when incidents like what has happened at the Hani Hospital happen again.
Look, we've got contingency measures at our facilities, and that's why in Hani, the example that you've just made, when the system was able to immediately detect that there is something wrong that would compromise patient safety, so the doctors were able to immediately pick it up, and the staff went into what is called the emergency response mode, and they ensured that each patient was stabilized before being moved to an alternative ward. All our life-sustaining equipment at the facilities have got sensors on them to alert us when their pattern changes insofar as the oxygen supply and medical air within the particular wards. So hence we were able to move the patients to a safer ward without any casualties. And also what we are doing furthermore, besides the issue of the medical attention, is just to strengthen security within our very facilities. We are continuously doing assessments, even now working with our sister departments within the facility. There's an assessment that has been done in terms of what could have gone wrong, because it doesn't seem like there was a break-in, because when you look at the room where the theft happened, it's one of those well-secured places, and it would seem like the thieves were able to gain easy access, and something that we're going to obviously be looking at the CCTV footage, and then the police already have started with their investigations to look as to how would the criminals have gained entry into that particular facility, and also the time that it took them to actually cut the pipes and be able to flee from the scene. But patient safety obviously remains a priority for us to ensure that at any given time, when this kind of incidents do take place, we're able to activate our emergency response systems by acting quickly to ensure that we will preserve lives.
And Modiba, we know cable theft is not the only problem Gauteng hospitals are facing. There's also the problem of load shedding, and this is happening even after promises that hospitals will be exempted from power cuts. So help us, what exactly is the problem at the moment?
Look, the issue of load shedding, I think it's one that is well known, is one that we assist with as a country, and I think at a national level, there are various interventions that are being made in terms of circumventing the load shedding matter. But maybe for us in Gauteng, what one needs to say is that as part of the short-term interventions, is that all our hospitals, we've got about 38 or so hospitals. We've got about over 360 clinics across the province, and our facilities have got generators as a backup system. We also ensure that we're now employing new technologies in terms of ensuring that where we can, we then deploy issues of solar systems. Obviously, with generators, the issue of regular maintenance is quite key, but and also the issue of security of supply, insofar as diesel is concerned, is quite significant for us, and we are continuously ensuring that from as far as maintenance is concerned, our generators are well maintained. As far as diesel is concerned, we stock up enough. In fact, we've got long agreements in place with many service providers to ensure that at any given time they are continuously supplying us with enough diesel. Recently, in the Gauteng provincial legislature, a member of the executive council responsible for finance did announce that the Gauteng provincial government will be embarking on what is called a rooftop solar power project, which is meant to really alleviate the pressure at our healthcare system by ensuring that within this financial year, there are about 11 or so hospitals which are going to be piloted as part of phase one of the rooftop solar project, whereby solar panels are going to be installed to harness close to about 10 megawatts of their own electricity power from rooftop solar PVs. We want to then look at that and see as to what extent can that assist us in terms of alleviating and mitigating against load shedding. We do know that, of course, that in terms of some of the interventions that the national government has announced include that an engagement with Eskom, which is the national electricity supplier into the country, to then look at exempting some of our facilities. Already, of the facilities that I've mentioned that we've got in the province, especially the hospitals, half of those are already exempted. The challenge, of course, with the other facilities is that sometimes, in some instances, it's not possible to immediately exempt the hospital, because for you to exempt it, you'll have to have the whole area exempted, given that the nature of the network, the way it is now, is such that the hospital feeds from the same supply line as the rest of the communities. So there is a long-term plan to say, how do we then isolate your healthcare facilities so that they then are able to be supplied with electricity from an independent line. That way, you would be able to then isolate your healthcare facilities. So there are ongoing engagements between Eskom and local municipalities to find solutions around that. We're looking at both short-term and long-term solutions so that we then minimize the impact of load shedding on our healthcare system.
Motalatale, Modiba, many thanks for speaking with us.
Thank you very much, sir, and for the opportunity.